Good afternoon. This is Erin with the Department of Medicaid. It is not quite 2 o'clock and we are still clearing out the waiting room. We'll
Great.
give it just a minute.
Thank you, Erin. And I see Miranda. Hi, Miranda. Do we have any of our other TAC members on?
So far, you're the only two I saw logged in.
Okay. Now, I know that Christy won't be able to join us and Melanie as well. So they're both unavailable today. So I think we're looking for Arthur and, oh my gosh, what am I blanking?
Brenda.
Brenda, thank you.
You're welcome. Brenda just emailed. She's having an issue, so Kelly's going to resend her the link.
Okay.
And we're still clearing out the waiting room. So as I get it clear, we get more people popping in, which is a good thing.
Yeah. We can give it another minute or two.
The waiting room is clear. Well, no, it's not. Sorry, it was cleared, but Brenda's not quite logged in yet.
I
But
think we
we're
can go ahead and
okay.
wait for her, knowing that she's trying to get in.
And I'll
And
keep an eye out for Arthur as
I,
well.
I was going to say, I haven't heard from Arthur, although he usually lets me know if he's not able to attend. But there's always a chance that some things come up. You know, if Brenda's issue is that she's trying to join on her phone, or
I'm
was
not
it
sure.
Melanie who was emailing us about that?
No, that was Brenda. Melanie and I have figured out what
Okay.
was causing her hiccup. I went into our Zoom account to find the meeting link, and she's saying it's not working. So I'm not positive.
Yeah.
So Kelly said she sent her, is going to resend her the link. So I did check it off the website. I know she prefers, I think, to log in through her app.
Right. Which requires the participation code, I think, instead of the link. And usually the code is like embedded in the link. It's just that you have to have the code kind of cut and paste separately. And actually this
Oh,
talking about the Zoom link reminds me,
she's logging in now. Sorry, I didn't mean to cut you
oh,
off.
no, perfect. Miranda had texted me right before this meeting and said that on the website, our meeting is scheduled for 1 o'clock, or it's listed as being at 1 o'clock.
I noticed
So
that, and I've been trying to get some website edits fixed. Long story short, there's a bit of an internal battle. I'm not a coder, so if there's an ADA error on the page and you have to fill in a code link, I'm not able to do that. So sometimes our publishing is taking a little longer. So I apologize about those things. Going through 17 tax, getting them set up. Sometimes I miss things. So sorry about that.
well, I'm glad you're working on getting it updated. And we'll, of course, we have the calendar invite, which is good to have, and that was correct. That was 1:30. So, um, just maybe let us know whenever it does get updated. I have in the past shared the TAC webpage and like it's on the top of the agenda as the place to go for the meeting information. But now that you send us calendar invites, I might not do that any longer, just so that we don't ever have conflicting information between the two. And welcome, Brenda. I'm glad you were able to get
Thanks.
in.
I couldn't, the link that you had on the top of the page, consumer, it said invalid link. It would not take me there.
I think that probably the link on this agenda is old, but the link in the calendar invite is the correct one. So I'm going to take that information off of the agenda from now on.
Yeah,
Because
it just seems like such a problem for me to even get on the Zoom because I can't find the meeting ID. I can't find the passcode.
the
And
calendar invite, are you getting those now
who is the calendar invite from?
from Aaron?
No, I mean, it doesn't
It,
allow
I
me to
think
go there.
I think it comes from our Mac TAC calendar, so it doesn't come from my email address. But
If I
she
just
is,
got the meeting ID and the passcode, I can go to my Zoom app and get on there. But this is the first meeting I've ever had that doesn't send you the Zoom link right before the meeting. So it's just difficult.
Well, see, I think what we're maybe like crossing is that Aaron has sent it to you more than once, and I'm wondering if you're not getting it.
Is it the same meeting ID and passcode every time?
yes. Yes,
Well, I
ma'am.
had a meeting ID and a passcode and I tried to use it and the passcode, it said invalid passcode just today when the one she had sent me in the past.
Yeah. I mean, what my hope is that we can get those calendar invites on your calendar. And that sounds like something we need to do separately from this meeting right now, but I feel like that's where it's still something is just not getting to your email and to your calendar.
Well, even with a link, I would prefer to go onto my Zoom app and be able
Right.
to control the meeting from there.
Right.
But
And that participant ID is what I was mentioning, Aaron, which is what I think Brenda needs, which is generally embedded in the link, but can be put into the meeting invite separately. So we should be able to get these details worked out, I think, for the next meeting and moving forward. But I do want to make sure that you're getting those emails, Brenda, because that is a little curious to me.
I'm getting some emails and then I go to click on the link and it says
It's still
invalid
not working
link.
for you. Yeah,
That's
I'm
what
not sure
happened
because the link
yesterday.
works for me, but we'll figure that out before the next meeting. Welcome everyone. Sorry it's taken us a few minutes to get things started today. And happy post sine die if anybody's been working on the legislative session. Very nice to have that behind us for the rest of the year. So why don't we start with introductions? I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and the Chair of the Consumer TAC. And I believe that Miranda and Brenda are the other two TAC members that we have with us right now. So why don't you two go ahead and introduce yourselves?
Hello, I am Miranda Brown, and I am a representative from Kentucky Equal Justice Center as a member of the TAC.
I'm Brenda Menino, and I'm a representative of the AARP organization.
Great. And Aaron, if you could let me know if Arthur is able to join us, then we can make sure that he's able to introduce himself. At the moment, with 3 TAC members, we don't have a quorum, but if Arthur does join, we will revisit that part of the agenda. And without a quorum, we're not going to go and go over the minutes or ask for those to be approved. We can start with the standing data requests.
This is Jordan Griffin with the Department for Medicaid Services Eligibility and Enrollment Branch, and I can I have a slideshow to present here. Give me just a second. Can everybody see the slideshow?
Yes.
Okay. All right, so for our current enrollments, we have 1,506 members in presumptive eligibility, 274 members in emergency time limited Medicaid right now. Our traditional Medicaid or fee-for-service numbers are 172,097. And then we have 1,389,304 members in managed care for a total enrollment of 1,561,401. And then I think we wanted to talk a little bit about some of our SSI termination enhancements. All of our SSIR terminations were paused as of February 16th, 2024. Members will continue to receive SSI Medicaid while the terminations are on hold. We're shifting our approach to members losing eligibility, and it's going to be a two-phased approach. So phase 1, beginning April 26, 2024, our pre-populated Medicaid renewal forms will be sent. The member will be given 2 months of ex parte eligibility, expanding their eligibility period to other termination codes. So normally they would only get ex parte for specific termination codes. We're extending that to most all codes unless it's something like the member's deceased or they're now an out-of-state resident. Redetermination will be completed based on submitted information, and notice of eligibility will be sent. The member, if they don't respond by the 15th of the second month, they will be terminated, and reapplication and self-service portal will be permitted in the phase 1 approach. Phase 2, beginning July 19th, 2024, processing of eligibility based on verified information and return renewal packet will follow normal renewal procedures and adverse action rules, potentially terminating the member before the end of their ex parte period. We're also going to add a new Salesforce nudge campaign for these terminations. And just as a note at the bottom, our SSI members whose terminations were paused will be sent the pre-populated form sometime after April 26th to complete that redetermination process. On this next slide, this is just an example of some of the new notices that are going out. This first one is going to be the front page of the renewal packet, saying we need information from you. This is just the first page, and then it would be the renewal form for the rest of the pages. The second renewal is just the reminder that's going to go out if we haven't received their renewal. And just as a reminder that we've sent them a renewal packet and their due date, or else their benefits may terminate. Any questions about the SSI changes?
Yeah, thank you for this update, Jordan,
Sure.
and for all the work that you've been doing on this issue. Could you go back to the previous slide? So just to make sure I understand these two phases, right now, the terminations are on hold. Is that what will go back into place on July 19th? Terminations in phase 2 will be active again?
Um, I'm not sure if we've set a specific date for the terminations to go back into play, but I'm assuming it's going to be whenever we start the pre-populated renewal form.
Okay. When I read will follow normal renewal procedures, I thought that meant, kind of back to normal. But maybe that's not what you intended there.
It could be that they mean to do that. I'll have to double check with our systems people, but that makes sense, that it would be July 19th if that's when we're implementing phase 2.
But for now,
Mhm.
terminations are on hold and you're giving
Correct.
people more time to complete the renewal packet. And moving forward, this is ongoing. Everyone will get a renewal packet before they ever receive a termination notice. Is that right?
They will get yes. So if they get a renewal packet, I think the only reason we wouldn't send one again is if we've gotten notification that they're deceased,
Right.
or if they've moved out of state. Actually, we may still send one for out of state because it could be something systems related. If we received information from our systems, we need to give them the opportunity to rebut that if it's not accurate. So, but probably just for the ones who we get notification that they're deceased, we would not send the renewal packet. But for everyone else, prior to termination, they should get the opportunity to return the renewal packet and have their eligibility redetermined on all bases.
Okay. Yeah, that's really helpful.
Mhm.
And then one question that I've had, and I know you've been doing a lot of work in this area, and you even helped recently with a case that had come to us. It was a child with SSI that was terminated, and the rest of the family, or at least that child's siblings, were Medicaid eligible or K-CHIP eligible. But the child got a discontinuance notice before, any household information was used to determine eligibility. In those cases, I realized that with SSI, you all get a file from, the Social Security Administration, and you use that to determine eligibility, and it is a separate process. But when you are aware of someone living in a household with others and you have all of their household information, is there any way to link that together so that in those cases, like for this particular child, all of their other household information could have been used to determine their eligibility before it went to discontinuance?
I think the issue is that the member has to re-request benefits in their case. So like in that situation, the mother is the head of household, they have their children on the case. They would have to reach out to us and request that their benefits be reestablished in their separate Medicaid case. I'm not sure systematically if linking that way is necessarily possible, but they are linked by a specific individual ID. And so any information we have from one case is stored for that member for if they're in another case. That's something I can take to our systems people and see if there's any way to do that
Yeah,
automatically. Yeah.
I would appreciate you all looking into it. I feel like, there are certainly the cases in which, we've discussed this on previous calls where you don't have all the information necessary to determine
Right.
eligibility. And that's when a renewal packet is, the right next step. But in this case, technically, you did have access to all that information. It just wasn't necessarily in the same place, it wasn't in the SSI part of the system. But if there's a way to link it and to first go to the household information on file, that could really reduce administrative work, of course, but also any unnecessary churn or requests of the family.
Sure, absolutely. Yeah, that's something I'll take back
Okay.
and see if that's
Thank
something
you.
that's possible.
Yeah, I appreciate
Um,
that.
Yeah.
Could I ask you to go back to the second slide,
Sure.
the current enrollments? Just want to be sure I understand this. So only 172,097 are on traditional Medicaid right now.
That's correct. Yes.
It seems like a very low number.
A majority of our individuals are subject to managed care. Normally, they're only exempt managed care if they are receiving long-term supports or if they fit into like the emergency time limited Medicaid category. Um, so this is kind of our usual, we hang around this number.
So that was the same number during COVID with the expanded Medicaid?
Um, are you, which one are you talking about? Are you talking about the same
The,
number for the managed care?
the traditional Medicaid number.
It varies. I think last month it was around 100 and I don't know, I can't remember what it was. It varies month to month depending on people's circumstances and who we have and what kind of services they need to receive. I
So,
can't tell you,
this,
I don't have the numbers up to compare to COVID numbers at the moment, so I can't tell you exactly what they were during COVID.
so this 2 months extended eligibility should help several other people numbers to go up on the to actually increase those traditional Medicaid numbers.
You're thinking about people with SSI and who have the 2 months of ex parte coverage, Brenda?
Oh, yeah.
Is that what you're thinking about? Yeah.
Well, SSI is tricky because it can be both managed care or fee for service. So again, it just depends on that individual circumstances, whether or not they're going to fit into the traditional Medicaid bucket or managed care.
I see. That's what's confusing.
Generally speaking, and you mentioned long-term care supports, Jordan, waivers, the 1915C home and community-based waivers are generally traditional Medicaid as well. Is that right? And then
Yes,
people in long-term
absolutely.
care, nursing
Yeah,
homes, that kind of thing.
they would be. And I also wanted to mention that we do have a specific notice going out to individuals who have their SSI terminated regarding the needs to get a disability determination to keep the correct type of Medicaid for waiver services. I just don't have it posted in this PowerPoint. Um, but we do have a notice written out that's going to go with the SSI renewal packet to let them know of that process so they can be aware ahead of time and get it started if needed.
Yeah, that's going to be helpful.
Thank you.
Yeah, absolutely.
Something else that came to mind when you asked that question, Brenda, the DMS has a really nice page on their website that is basically called statistics or data. And you can go there and look at every month, the number of people enrolled in these different categories.
Mhm.
And if somebody at DMS can put that link in the chat, I know the website was reorganized recently. So some of the links that I have may have changed, but I go there often to look at, what the enrollment numbers look like. And you can go back to, the pandemic era, reports to even see what those numbers looked like then.
Okay, thank you.
Yeah.
Just put it in chat for you.
Thanks, Jordan.
You're very welcome.
Any other questions related to our enrollment numbers or SSI?
All right. Hearing none, we'll move on to our APTC renewal process enhancements. This is another project we've been working on. Move that out of the way. So some Medicaid members with renewals from May 2023 to January 2024 cascaded into APTC eligibility and were sent notice of eligibility that their Medicaid was terminated. Members who did not enroll in a qualified health plan or return to Medicaid since their termination will be reinstated to traditional Medicaid fee for service back to their termination date. They will be sent a renewal form to complete a second renewal to maintain eligibility. And these renewals will be split between May and June of this year. For members who did end up they lost Medicaid and then got re-enrolled into Medicaid later, but they have kind of a gap of maybe a few months in between. They will be reinstated to traditional Medicaid to fill any gap between their original termination date and their re-enrollment date. And they do not have to complete another renewal since they've already been determined eligible through the re-enrollment. And with this, we have a couple of notices. So we have two different notices for two different populations. So we have the individuals who are going to be subject to a renewal to see if they can be determined eligible for ongoing Medicaid in addition to their reinstatement. And then the second notice on the right-hand side, notice for members who are not subject to the second renewal, just letting them know that we've reinstated a period of time retroactively from where they transitioned from Medicaid to APTC. Anybody have questions about this APTC renewal process?
When did these notices already go out, or when are they going to?
So they have gone out. I actually talked to a member who received one of these notices already, and she was like, "Oh my gosh, I got my Medicaid back." I was like, "Yeah." So I didn't realize that anybody was going to already be calling asking questions, but they are. So these have already gone out.
Well, I'm glad to hear that people are getting the notices and calling.
Yes.
That this is, I don't think you mentioned it, Jordan, just now, but I think in a previous maybe email that we got, it sounds like 29,000 people are receiving these notices. So it's also good for us just as advocates and, you know, anybody working kind of direct services to let people know to be on the lookout if they lost their Medicaid coverage and had some question about their eligibility. But we definitely want people to respond to that and take advantage of the opportunity to get their coverage reinstated. And for some individuals, I think they probably assume they're no longer eligible. And so they'll need some encouragement to know that maybe the notice you received a few months ago may not have had, they didn't have all the information that they needed to make that determination, and you should try again.
Yeah, it never hurts to just return the form and see what happens. It's not gonna, there's not gonna be anything adverse that happens. It's just all, we need to make sure that that you were terminated correctly and that you're not still eligible. So that's kind of what we're doing as a mitigation to that.
And Miranda, I think you had a couple of these cases where people got the notice that they were eligible for QHP without having gotten the RFP or RFP with the RFI.
Yes. So I've already seen one person who had her coverage reinstated. The question I have is, I understand that these notices are not visible in Connect, right? So how are you somehow notifying connectors of which clients they have that may be affected?
Um,
I can answer that.
yeah, go ahead,
Um,
David.
Yeah, we have a data poll that's on the way, and once we get those, that information will go out. Hoping for next week. Could be this week.
Okay, thank you.
Yep.
All right. Any other questions related to this?
Anyone have other questions? I think we can move on, Jordan.
Okay. So next we have our unwinding report updates. These are based on our monthly reporting to CMS. This just kind of gives a breakdown month by month. This is over here on the left is what we originally reported. And then on the right, we've recently been required to submit updated monthly reports showing the outcome of any pending cases after the 90-day reconsideration period. So the table on the left shows what we originally reported. The table on the right is showing the outcome of those pending renewals. So if you see, like for December, we had 2 pending renewals, and then after the 90 days, they're no longer pending. So that's just kind of an overview of the unwinding so far. And then on the next slide, we have our current renewals. So for January, February, and March, individuals procedurally terminated on their renewal due date are given 90 days to respond and provide requested information. If they are determined eligible, coverage is reinstated back to their termination date. Months that are still within the 90-day window and are still processing are included below. So you'll see in March, we had 97,962 individual renewals. 70,000 of those were approved. 6,000 were terminated. We had 72 pending. Almost 20,000 were extended out to a later due date. And then we've had 432 individuals reinstated as of the end of March. Any questions about these numbers?
I don't have any.
No.
All right. And then just as a note down here, March and April renewals are still in process. We don't have the figures yet for April. Here's some helpful links to our PHE Unwinding website where we publish all of these numbers and any updates related to unwinding. We have our ongoing stakeholder meetings. They're every third Tuesday at 11. And then we have several reports that are also posted there. Any questions about anything?
No, that's all really good information to have. Thank you. And I like the slide deck
Yeah.
that you're sharing.
Well, I can't
Great
take full
knowledge.
credit for it. I can't take full credit for that, but it is very nice.
Some of it's probably doing double duty with your stakeholder updates, but
It
it's nice to have the numbers in front of us. So thank you for that.
You're very welcome. Thank you all.
Aaron, looks like you're just pulling up the agenda again. That's what I was going to ask. Thank you. Oh, it went away.
It's
Okay.
thinking about it.
Yep.
There we go.
I see it now. So we covered a number of those initial items there. And I think that you probably even covered a few more things than we had under 1 and 2 or A and B. But the next item that we have here yet to cover is the HCBS rate study and the PDS rate increase. Is Pam on?
I'm here. Yeah, I'm sorry. My headset was doing it kept turning mute on and off. Do you want me, Emily, to go back first and talk about the number of people that are getting waivers, that number 2 under A that are getting waiver services and the wait list?
Yeah, that would be great. And also if you want to go in whatever order makes sense to you, and I know we have a number of different
Okay,
items on the agenda
I'll
that
pick
you're probably
through.
going to report on.
Yeah, I'll pick through all of my things and then we can circle back. So right now, or as of the 31st of March, there are 30,981 individuals receiving services across the 6 waivers. And Jordan made it really hard to follow with that awesome PowerPoint. So I will get you all these numbers out in written form so that you all don't have to try to remember what I'm saying. But so 30,981 individuals receiving waiver services. We do have 4 waivers that currently have a wait list. ABI long-term care, there are 6 individuals on that wait list. 3 of them are currently receiving services in another waiver. For SCL, there are 3,479 on the wait list. None in the emergent category or in the emergency category, 70 in the urgent category. 2,069 of those individuals are receiving services right now. For Michelle P. waiver, there are 9,056 individuals on the wait list. 2,511 are currently receiving services in another waiver. And our home and community-based waiver, there are now 1,979 individuals on that waiting list, and none of those individuals are receiving services in another waiver.
Speaking of the waiting list, there's some good news from the legislative session, which is that a lot of new HCBS waiver slots were funded.
Yes,
And I know
so
it's probably too soon to say that you have like a full plan, to, fill those slots, but I was curious to know if there's anything you can share today.
So I can say step one, and this is regardless of, of waiver or, how the new slots are given, is that we will have to do waiver amendments to get the CMS, the corresponding federal funding. The good news is that as part of doing the implementing, the full rate study methodology, as well as, other things that we've been that we are changing as part of redesign, is that we're going to be doing another waiver amendment very soon, because we'll have to do that to implement the rate, to implement the permanent rates that are going to be based out of the rate study. So it is on our radar to do that sooner versus later so that we can get those slots. The other thing with HCB is we're it will, well, with all of the waivers, we, are reallocating the slots now when individuals unfortunately pass away. So they lose a slot there. We have been allocating those. We do have, much like we do in SCO, where we reserve slots for emergencies, for both Michelle P and HCB. There are some available slots right now. And I don't have those numbers right in front of me, but we retain those for in HCB for individuals that have lost their slot for no fault of their own. For example, they may have lost SSI, so we don't want them. So they've lost their Medicaid eligibility and they're working to get that back. We don't want them to have to go on the wait list because of that. So we retain a few slots. So it's less than 50 that we retain for that reason, so that we have those slots that we can give to those individuals that are waiting because, and they're working through issues that were no fault of their own. Or say, for example, they fell and they broke a hip and they were out of services for a period of time, longer than a normal period of time. We want to make sure that they're able to return to services. And then Michelle P, so BDID, who administers that waiver for us, they are actually allocating slots every month. They've been allocating a number of slots, and they still are continuing to do that with Michelle P individuals. It's a very interesting thing to have that many individuals on the wait list. Each time we allocate slots, only about 50% of them end up getting used. So we either can't find the individual, or they say, you know what, I don't want that. Don't know why I signed up for it. And so we end up then, those go back in that, go back in that available bucket, and we reallocate them again. So, but it's a pretty consistent phenomenon that 50% of the slots that we allocate on Michelle P each time, we end up putting back in the bucket to allocate again.
Yeah, that's a high number.
Okay,
One other
so
part of that budget language I was going to ask you about, Pam, and I didn't follow this as closely as some people, so it may have been fixed by the end of the session, but there was some language that was requiring DMS to do some sort of assessment of the waiting list. Can you tell us how
I will
that's
be fully transparent in that I have not seen all of the final language. And so we will be, we'll have to respond to that, but I am not prepared to give any kind of, to discuss that or give any kind of response to it. We did review all of that as well. And, in addition to what is in the budget, we're also following the access rule that with CMS, because there's a lot of language around wait list in the access rule, and things that we will have to do to be compliant with that. So we are also watching that with CMS, and when that becomes final, and what the language will be in that. But there is a lot of language about waiting lists versus interest lists and reporting that you have to do both federally and that you have to make available to the public. So I think a lot coming on
I was
the
going
topic
to
of
say
wait
our
lists.
in 2 months, when we have our next meeting, that might be a good time to do more of an update on.
Right, we can have more,
that
we
rule.
likely will have a whole lot more information at that point in time.
All right, thank you.
Okay, so the rate study and the PDS rate increase. So rate study, we, I can tell you, are looking at, now that there was funding that was allocated for that. So it is in, I believe, final review processes with people who are way more important than me. So I don't have much of an update other than it is really, now at this point it's being looked at. We also have to consider the implementation of the rates, in addition to, the 20% increase that was done through the ARPA spending plan, what we can change, while we are still spending through that money. So there's a lot of moving parts with implementing the final rates. In addition to, we'll have to, of course, update the waivers again, which means they also will go back out for public comment when all of that happens. So lots more communication to come on the rates and what that looks like and how that's going to happen, and when it'll be out there for public review. The PDS rate increase, does anyone know? I mean, that right at this point in time, the PDS rates are the same as the traditional rates, and PDS individuals are able at any point in time to request a change to their rates. That can be any change. That's if I want to increase my rates, or, we have some individuals who have really thought about their plans and have realized that if they pay a lower rate, they're able to get more hours in HCB, for example. So they've been able to use, have more than that 45 hours because they, pay their employees still a good, a rate that's agreed upon between them, but they're able to have more hours. But it's truly up to the participant, and the participant, or with the help of a representative, if they need the help to do that, to manage their PDS program. They are in the driver's seat for that plan of care and any modification. So if you know of anyone that's having trouble getting that done, just if they reach out to us, let us know, and we will help. Dale can, as Dale administers those services, they can work with the agencies and work with the individual to find out what the problem is.
Could you remind me what the PDS stands for?
Participant directed services. So it is where the participant is the actual employer for their services. So instead of it being a traditional agency that provides the employees, the participant actually hires and manages their own employees. And then they're reimbursed or paid through a financial management agency that is a provider with Medicaid.
Thank you.
You're welcome. I forget, Brenda, we speak in alphabet soup. And so
Pam, I was just looking at the participant list to see if Arthur had hopped on, and he hasn't, but I think
Oh.
he'd be the person to, know how well this is working or if it's not working for anyone, but we can, we've had this as a standing item, so.
Okay. And he knows, he has my email address and my contact information. So he knows how to get a hold of me. Let me see. I'm going to jump down before I do 1915I. I'm going to talk about a couple of the other things, and then I'll come back to 1915I so that then the other behavioral health updates can follow that. End of Appendix K for the HCBS waiver. So all of our waivers, with the exception of Model 2, which Model 2 was effective, I believe it was January, February. It was earlier in the year that we got the approval on Model 2. The other 5 waivers we received our official CMS approval with an effective date of May 1st. The webinars, we recorded both a participant and a provider webinar. And so those decks and those webinars are out on our website. And before we're done, I will get the link to those and post it in the chat, that go through what continued. So what's been made permanent from Appendix K versus the services that we decided not to continue beyond April 30th. So we've been reaching out to case managers. So we've identified, for example, some of the people that were getting the higher limit of home delivered meals or needed to change their home delivered meal provider from maybe an adult daycare to one of the certified home delivered meal providers, or individuals that had been getting maybe overtime. We've had individuals reaching out to those case managers to talk to them and work with them on getting those plans of care modified so that we didn't, that didn't go down to the very last minute of May 1st and there not be a plan in place of, what the change was going to be to the plan of care. We've been answering, had a few good questions that we've received from individuals that have watched the webinar, a few from individuals that we've redirected that maybe they should watch the webinar or listen to the webinar. But we, are here always to answer any questions about that. But we're very excited when we received the approval from CMS on those remaining 5 for that effective date of May 1st. The most important thing, of course, that I think most providers were looking at that continued was the rates. So the rates that are in play right now are the rates that will remain in effect until we implement the rates that come out of the rate study.
That's
The
good.
EVV provider change from NetSmart to Therap. So communication is starting to go out to the providers that are part of the PCS or personal care services that are using NetSmart right now. We have a meeting with some providers that are going to be our change champions. So they are individuals that have been with us from the very beginning, that have used EVV from the very beginning, and have really worked closely with us. So they're going to help us to review training materials, to review communications, to maybe help us think of things that we sitting, I always like to say, I can sit behind the desk and think something sounds, oh, in theory, that's going to work great. But, when you go out to put that in practice, you're like, you're crazy. That does not work the way you thought it was going to sitting behind your desk. So, really getting that on the boots on the ground perspective of how things work and to make sure we get it right from the beginning. So lots of communication that is just beginning on that change. The home health implementation, we implemented the very end of December. It was mandatory as of January and has went very well with Therap. We've had some hiccups, which I think is going to be expected in any implementation that you have, but we've been able to work through them very quickly. Have had great provider adoption, so I'm excited to see how it goes with PCS, but I'm very positive about how it's going to go. Again, people have problems, they have questions, they know how to get a hold of us, and we'll work through all of those, but I think very positive about where we're going. So I will, before I go to SMI, or the 1915I, any questions on either of those?
I don't have any. Brenda or
And
Miranda, do you?
and I'll say EVV is electronic visit verification. So for anybody that didn't know that acronym.
Electronic visit verification. And what was the other acronym you said? Was it PTS?
PCS, it's personal care services.
I think that may have been an update that Melanie wanted. So it's good that we have a recording. She can review that when she's got a chance.
And she knows how to get a hold of me too. So if she has any, you can let her know if she has any specific questions just to reach out.
Okay.
Okay. So my last portion of updates before I'm going to turn it over to Leslie, the 1915I for that's select services for individuals with serious mental illness and some services for substance use disorder is we had planned or had hoped that we already would have been able to submit to CMS. We ran into a few roadblocks. We received a ton of public comments right at the very end. So it's taken us a little bit longer to get through reviewing all of the public comments and getting the responses out. We are targeted to have that review done by the end of this week. And we also are meeting with CMS on Friday to discuss the waiver with our new target date to submit the waiver to CMS by April the 30th. And I do not see any barriers in us meeting that. So responses to public comment will be posted very soon. And then after we meet with CMS on Friday, barring them asking us to change anything or them giving us any different guidance, our target is by April 30th. So 2 weeks from today that we will be submitting the 1915I to CMS for their review.
All right, thanks. We'll look forward to seeing the responses to the comments.
Okay, and I'll go on to the next one and just you all know, but I'm very excited and very proud of everybody that's made all this happen. We've got the 1915 I State Plan Amendment, and then we have the companion SMI 1115. I'm sorry. Yes, sorry, SMI 1115. And so I just wanted to give you an update about that. I've got too many going on right now, Emily, and I was like, is that the right one?
I do the same thing.
Yeah, we sent it in. Oh, and I was going to make just a reminder on D on your, just remind everybody that the I is a state plan amendment and the C is not is a waiver, but it's not a C. It's just 1115. Everybody gets those confused. I just wanted to update that. So it's 1915 I and 1115.
You're right. I put the C on there and that's
No,
actually,
it's fine. Most of the time people still put the C, on the 15 because it's what we know, right?
it's 1915 C. Yes, I know.
So
See,
yes.
it happens to us all.
No, it's fine. We had one the other day that somebody done something similar. So the SMI 1115, we sent that in May. We did have some reach out, and I think I may have told you this, maybe even on another call. We did have reach out from CMS to start having conversations because we have lots of things at CMS right now. The biggest of what we have there is our largest component or umbrella called Team Kentucky, and it was time to extend that. So instead of a renewal, they call it an extension because it's a demonstration. So we have that with CMS, and then you have all these components off of it that we have sent in, and we're kind of waiting to get all those approved along. It's my understanding that CMS is really trying to figure out how to streamline states that have many of those, like connecting just like we do, because during COVID, they all kind of got behind. And they had over 50 at the end of last year to still review before they were ready to talk to us. CMS did ask us as part of the negotiation phase to start completing an assessment, the landscape of available services in Kentucky, and for providers for mental health treatment. So that's kind of what we're working on right now. You may hear from us. It's not like this huge, big endeavor. It's kind of like being proactive for the implementation plan that's coming. So remember, anytime we do an 1115, it also includes an implementation plan. So even if CMS approves our 1115, then starts the clock, I think they give us like 90 days to complete an implementation plan. And then they have a time frame that they can complete that one. So unfortunately, the last one, which was SUD, which I don't figure that this would take this long, took almost a year to get that one approved from CMS, but I'm hoping that this one will be quite a bit quicker. We actually anticipate that we will have an approval any way, shape, or form, or whatever we have to do by third quarter of the calendar year. So what is that, July? Yeah, July through September-ish. So I'm thinking maybe before, like latest would be September, but I hope to have it before then. So again, these are companions. We're very excited about it. Both the I and the 1115 make reference to each other as companions. So CMS is aware of that. And did you have other things for me? Let me see.
I think the housing meetings may be
Oh,
something that you're familiar
Was
with.
that
It may also
old or
be
new?
Angie. That's an item that we've had on the agenda before, and Melanie had requested that we keep it on the agenda just for any updates that you may have.
Okay, so if it's the housing meeting that the cabinet and DMS has with KHC, those all started based on we had participated in a federal collaborative, but it was very much about SUD and housing. So we realized that we needed to have a larger scope. So then we started reaching out to our partners. About the same time, KHC had reached out to the secretary's office. So we started what we call a housing and health collaborative. And so we've continued that. That's been going on probably for the last couple of years. So we continue to partner with them on housing initiatives and opportunities across Kentucky. I thought maybe this might be, you might have recently seen a NOFO opportunity that KHC has applied for, and we supported them as a cabinet. So we got support, we sent in support letters to support them on this opportunity as well. The collaborative's focus is really started out more about the housing supports the homeless supports in the 1915I that Pam just spoke about, because originally we thought that was going to be in the 1115, and then based on all the pieces that we need, we had to end up writing an I and an 1115, and I know that's all very confusing. Upcoming discussions with KHC, we're trying to figure out how to align our systems better, and I don't know if you're aware, but DMS for the first time ever is an approved HMIS, which is from KHC, a homeless management information system user. So we've never had that before. So we can now match up data. And mind you, all homeless folks are not in the system, but we're at least able to start connecting our folks with those folks that are homeless and try to pair them up. So that's been a very positive thing for us. And I think I've mentioned this actually all started from the original collaborative. So I don't know how much you knew about the housing. I thought maybe folks might have seen the recent NOFO that we were partnering with them on.
No, but I don't recall. Of course, it may be that it's come up, but I appreciate you sharing that information. So you're calling it a housing and health collaborative.
Sorry,
Okay.
that is correct.
You're looking for new partners to participate.
So this actually just started was specifically with them trying to figure out how we could partner on some initiatives, and that's what we had worked on for the I. We ended up placing those things in the I, the 1915 I. So there's a homeless, social determinants of health component within the I that talk about, like employment and education and housing. So, and it covers more than just SMI. So when Pam mentions that there's additional supports other than SMI, it includes additional folks, eligibility populations.
And Leslie, what is a NOFO?
Notice of opportunity, like for funding. Sorry, that's probably not the exact, but it's a notice of funding opportunity. How about that? So there was a governmental, not us, there was a governmental opportunity that housing wanted to apply for, KHC wanted to apply for. And so they asked us to support them in the endeavor, and we got like letters of support for them and sent that in with their application. I don't think they've heard back from it yet, but I just wanted to share that with you all.
That is a health and housing related notice opportunity. Okay.
Yeah,
Good.
they had, I think they put out something publicly that they were partnering with us, and so folks have been asking me about it.
Okay. Yeah, that's helpful. And, all of this work to really kind of align the needs of people who obviously have healthcare needs, but there's a housing related need there as well. I think is so important, and all of that kind of the new opportunities that we've discussed on some of these previous calls related to, I think they're calling it health related social needs.
Yeah.
You mentioned social determinants of health.
Same
I think
thing.
they're very closely related, but looking at how we can use more Medicaid funding to support some of those needs.
And being able to query reports on the homeless population and trying to figure out what groups that we have out there that are homeless, how much percentage may be in the SMI population, how many might be in the SUD, how many may be co-occurring, those kinds of things has been extremely important to leverage that information for services that we're requesting from CMS.
Any other questions related to that? Leslie, are there other items that you were planning on presenting?
I think Angie's actually going to speak later in new business. You had some if you have any questions related to new business on the SDOH screening referral and leveraging social determinants of health, she may be speaking later. Angie Parker.
Okay, great.
We did, one other thing, Emily, we did start, if you want to, you might want to know this, we are getting ready to start our kickoff of ACRES for the advisory group for our reentry population. So that's very exciting. I believe your name is on there.
Tomorrow, right?
Yeah. Yeah. So I'll see you then. But
Yeah, got it on
I'm
my
so
calendar.
excited about that. Like
I'm
it's
looking
finally
forward to it.
happening.
Yeah, no, I think that's great. And of course, we're still anticipating the approval of the waiver, but glad that you're getting a head start on things. Let's see, I'm trying to make sure that we're not, I know we've kind of skipped back and forth on some of these items, and I want to make sure that we're covering it all. Is the next item here, DMS surveys of Medicaid members and stakeholders that we need to cover. Now, I did see an email, I think it was just earlier today, with the stakeholder survey. So that's gone out to at least some listservs that you all have, and I was excited to see that. Is there any other update that you all can share about the member survey?
I can share a brief update. I mean, basically what you said, Emily. And oh, hi, this is Beth Fisher. I'm the communications staff assistant for the department. And yes, to confirm, some surveys went out yesterday and this morning to Medicaid members who had completed that request for information, seeking their feedback related to the return of member renewals and their experience, and also members that did not complete an RFI and were terminated. So far, we're getting a pretty good response. We'll continue to promote those throughout the month, and keep reminding our members to respond to that survey. But so far, we're pretty happy with the response we're getting. And another survey went out to stakeholders. So a lot of our providers and advocacy community received that one today, also seeking input related to member renewals and the unwinding process.
Yeah, that's great. Now, with these surveys, I'm assuming that they are not like they're not specifically being sent to somebody with a unique link in which, you know, only that individual can click on the link and respond. Is it a one link that can be shared far and wide?
That is correct. It's one link. And so for the stakeholder survey, we will share that with other groups and ask that our partners share that message out as well. For the member survey, DMS is sharing that directly with our members, so it doesn't go to people who, and we, because we, you know, to avoid getting feedback from anyone who may not be a Medicaid member who's just, you know, wants to respond to the survey for whatever reason. But the stakeholder survey will promote through other channels and on our social media as well.
Mm-hmm. Yeah, and I do understand not wanting to spread the member survey far and wide on the one hand. At the same time, I feel like not every Medicaid, well, I would assume that DMS doesn't have good contact information, whether that, I guess it's primarily an email address or a cell phone number that you're texting the survey to. And in those cases, you'd be kind of missing out on people who would otherwise take the survey. So are you thinking about social media or some other way of getting, you know, the information to them?
Yes, we will use social media. And so the message on socials will be a little bit different targeting our members. It will be more of an, hey, you're going to receive an email and a text message seeking member input for this survey kind of message. And it won't actually have that link in it. But yes, we do see a need to definitely raise awareness that when people receive these emails, that it's a legit survey and please don't ignore it kind of message. But yeah, I know I understand the concern about, you know, people's emails addresses change frequently, their phone numbers change frequently, and the information we have on record may not be the members' contact that they're using now. It is the contact they provided to us for the renewal process. So hopefully we'll get a good survey response. But yeah, we do just really see the need to make sure that you know, we want to avoid getting the member survey responses from people who aren't members. That's really the main concern there and why we're doing it that way.
And can you remind me if this is also going out in Spanish to Spanish speaking members?
That
Or any
is
other
on
language?
that is a goal. We don't have the Spanish version ready yet. It hasn't gone out yet.
Okay. All right, well, if you could update us when that's happened, that would be good. And does anybody have any questions about that? Hopefully Miranda and Brenda, you've received at least a stakeholder survey.
I'm gonna be honest, I've been on sabbatical and haven't checked my email.
It just depends on.
Well, that's a good reason not to check your email. We'll be sharing the stakeholder survey from KBH definitely far and wide. So I'm looking forward to seeing what kind of response you all get.
Thank you. We are too. Very excited. Or maybe excited's not the right word, but just very interested to hear what our members have to say and to just open up this line of communication.
Yeah, this is the first I remember of DMS doing something like this, and I appreciate it. Anything else about that before we move on? The next item here is network adequacy issue reporting process and reviewing the revised draft of the access to services form. I will say, I think, Aaron, you sent it out maybe yesterday, and it was the last day of the legislative session. I have not had a chance to look at it. I don't know if anybody else has, but I was hoping that we could use today's, the time on today's call to just pull it up and review it together. And then if we do need more time, of course, we can take some more time to pull together any thoughts and feedback, but would you mind pulling that form up?
You want me to pull it up?
Or yeah,
Or
Angie, if you
Aaron,
could do
or
it,
Aaron,
thank
do you
you.
want to pull it up?
Who-
Aaron, if you give me
Whichever
access.
Whoever has it
Okay.
handy.
Aaron, if you can give me access,
give
I've
me-
got it.
Just a second. Thank you. I couldn't get myself off mute.
Yes, I just sent this to Aaron yesterday, so there's no big problem that you haven't had a chance to review it yet.
I was happy to see it come through. I was just, it's been digging out of the last couple of months.
Are you okay? Let's see. All right. Are you seeing it? Are you seeing my
Yeah.
email?
Yeah, we can see it.
Okay.
Let's see it.
I don't like Zoom. Or maybe I'm just not used to it. This is Angie Parker. I'm the Director of Quality and Population Health.
Oh.
And are you still seeing it?
No, now we just see a blue
I went
screen.
away.
Okay. I'm gonna move it back to where it was and maybe you'll see it.
Yeah, if you have two different screens, sometimes it gets kind of wonky.
Well, I'm wonky, apparently. I'm gonna stop sharing and then try it again.
Angie, I pulled it up if you continue to have a hard time.
Okay, now we got it. Do you have it now?
Yes, I can see it.
Hey, okay, so I did get look through your email and your comments. Obviously, this is a work in progress and trying to make it understandable and what we're trying to do with this and how we're going to do this. Right now, you can use this form if you wanted to email it to us or mail it to us, but obviously it's still in draft form. We do want to get it on our website and have that capability to click and fill it in and it go, magic, it goes somewhere, but that is not in place and that'll take a little bit longer. But this is, I want to confirm because I know it was been talked about problems with having an in-network provider and having to go to an out-of-network provider that a lot of the members are having issues with, but I wanted to confirm that this would be they were unable to access any provider.
Well, I think ideally we want people to have enough in-network providers that's, the provider that they would go to. So I think access an in-network provider is correct in this particular case. There are times when if there's not a provider in network, then we would want the MCO to provide to, an out-of-network provider.
So we have, it's twofold. We have a problem with them getting into a in-network provider.
Right.
Then there may be other in-network providers. So we want to know if they're having problem getting into their primary care as well, not just, being able to go see a specialist that may or may not be.
Yes, I mean, so provider is broad in that sense that it would cover, primary care, specialist, behavioral health,
Right.
oral health, all of that. So I think that's the right term, unless Miranda or Brenda, you think that we should do something different there.
You want
I think in-network provider is the goal here.
to.
Yeah.
All right. The department wants to make sure you receive timely health care and did a little bit more in depth on what that means as far as urgent or non-urgent type appointments. And of course, if it's an emergency, we don't take the time to fill this out and to either call 911 or 988. And, you know, identifying that it helps us resolve provider network issues, and to assist, you may be contacted by DMS or your managed care. And it's important to complete the information below as much as possible. I know, go
I
ahead.
think all of that is good information before we go into the form, you know, where you have the parentheses, in terms of the timely standards. I think that's also a nice way to kind of boil it down, to distill it. I would, after that last parentheses, say, and make sure you receive timely health care in a reasonable distance from your home. And then in parentheses, put, you know, the 30 miles, 30 minutes, or 40, whatever it is, in urban and rural areas.
Okay.
And maybe put and a reasonable distance or something like that from your home.
I'll just highlight this because I'll
Yeah,
have
you
to
can
get all
work
the
on it.
specific.
But that's the only thing I see missing from the top there. I think, Miranda, your feedback on the last call was to kind of get into what those standards are. Do you think this is getting at that?
Yeah, I thought when I read this that it was just a lot clearer as to what the member would use this for and what they might get out of it if they submit it. So I appreciated that. I noticed that in the third sentence from the end of the paragraph, you say completing this form will help DMS identify, resolve. I guess you mean identify and resolve, so
Yes, thank
small
you.
typo, yeah.
I am not a good editor of my own.
None of us are.
And you actually have that the piece that you have here about identifying and helping to resolve any network issues, I think is really, really helpful. Hopefully, you know, once you start to get some of these responses, you'll have a better sense of, you know, how well we can do that in terms of resolving network issues. But it's good that people know that they can, you know, they can expect to hear from DMS or the MCO.
Anything else you think needs to be added to the top? I mean, obviously, if you think it's about something after this meeting, but you go ahead and contact me.
No,
Yeah,
my only
no, I-
other comment is for the very middle of the form.
Those two are the only other, I don't have an information about S.
Which part?
So the last question in section 1 was the MCO contacted first. I feel like if I were a Medicaid member, I might misinterpret that question. And so I was just thinking of possible ways to rephrase it. Like, have you or your healthcare provider already contacted your MCO about this issue? I feel like clarifying that it's about this specifically. And
Yeah, 'cause there were some other
Right.
ones.
And that the contact would primarily come from the member, but I think you're right, sometimes the provider. I think that's a good recommendation.
yeah, I put a suggestion for how you might reword it, but
That's fine. You can email me. Okay.
Now, on the referral and appointment information, where it says provider name, I think, you know, there are some people, they might not have a particular, they might be looking for a provider and they're kind of calling around and trying to find somebody. They might not have a particular provider, you know, that they are trying to see. Yeah, maybe if known. And then you have type of provider you need to see, which I think is really a critical part.
I was wondering whether or not I needed to put heart doctor instead of cardiologist, but I think most people know what a cardiologist is, but I will defer
Yeah.
to you all.
I think cardiologist is okay, and you put, et cetera, so hopefully people will fill out whatever. If they write heart doctor, then you all can interpret that.
I agree.
Basically, that's it. Have this information down here. We'll have it,
And
we'll have a phone number until as well.
I might have one more box where you could just an open-ended, anything else kind of box, because it looks like with the appointment date and times, the dates offered and accepted, you're looking for a specific entry. It's not going to be like an open field where people can say, they didn't give me a date. They said they had nothing. So I have a feeling you're going to get people who want to say there was no appointment available. And that's not going to be capturable here.
Okay.
Yeah, I think that's good.
Hello? Hello?
Might switch those two on the
Yeah,
appointment
that's,
day, yeah.
I would
switch.
put the additional comments
Yeah.
after the accepted.
Yeah. Yeah.
I know what you're getting at there. Angie, thank you for your work on this form. And I think with these edits, it should be, we can see how it works, and maybe, if it seems like there's something that isn't working, we can revisit it and make, more revisions to it. But I feel like we're getting close to something that I would feel ready to put out. I think you had said that this is something people could fill out like PDF form, or it's going to be like a fillable form online.
Yeah,
Is that-
hopefully, at some point, that's the ultimate, that's how we want it to be completed, but
Okay.
it may take a little bit more time. That's, a little more technical for me to work on, so, and get availability to do
I
it.
really liked the when you were doing presumptive eligibility, when DMS was doing it directly, that form that people filled out was really easy. If it could be similar to that, I think it would be something that it would be easy for us to share. It would be easy for people to complete. What do you think, Miranda? I know you had experience with that form.
Yeah, it was super easy.
Well,
was a
I have to
good
find out
system.
who knows all about that one. I'll check on that. Thank you.
Yeah. Anything else related to that?
We're, as far as network adequacy, we should be getting our first report from the MCOs in May regarding providers who haven't billed a claim in over a year, and finding out what's going on with those, and if they're truly, on the rolls, and available for our Medicaid members, but more to come on that.
Yeah, that would be interesting to see. I know you were kind of mapping that out as well, and knowing which providers are actually taking patients is always helpful. All right, well, thank you. Looking forward to seeing the completed form. Tell us if there's more that you need from us, that based on today's conversation. It looks like our next item here is the McIntack orientation packet. And I know that was also something that was sent out to us to review. Kelly, is Kelly on?
Yeah.
I know, Erin, you're on right now.
I'm here, and I have made all the changes, the suggestions that you sent back the last time. You said that the links weren't working for you, but they worked for me fine. So
okay. It may have been, I don't.
Sometimes you have to hit the control button and then hover over the link.
That's not normally how my PowerPoints work. And I wonder if that would work for other people, but
I don't, everybody that I've tested it with in DMS said that the
it's
links
worked.
to them, so.
Okay, good.
So anyway,
Um,
I just wanted to tell you that I anticipate leadership approving that as is with your edits. I just haven't had a chance to talk to Veronica about it.
Okay.
Hopefully I will be able to do that in the next few days and get that out to everyone.
Yeah, they were pretty minor. I mean, what you had put together was
Absolutely.
great. So thank you for your work
Yeah,
on
they
it.
were very much. No problem.
And
Thanks for
I was going to
clarification as
ask you,
well.
did you get my email? Because in my mind, I was like, did I actually press send or did I just draft that email? Because that's the way the last couple of weeks have been for me.
No, I got it.
Anything else related to the orientation packet that people want to discuss? Okay. Why don't we move on then to language access? And I know this is an issue we've talked about quite a bit, and I'm sorry that Melanie and Arthur can't be here for the conversation today because they had some other kind of specific concerns that they wanted to talk about. So we probably will keep this on the agenda for our next meeting. But as far as, other languages, spoken languages, that's something that Miranda, you've really been working on, and maybe we can focus on spoken languages today.
Well, if I
And
can
I
give you
see
just a
that
little
Brenda's having to
short,
hop off. Okay, maybe Brenda's already left, but
if I can give it just a short, just to let you know, you may or may not know, the disparity TAC has asked us about language access and how to do like an algorithm on how providers and members can utilize that, as well as the MAC. And we are working on that with our communications person, Beth Fisher, who spoke earlier. But I think this is helpful, just seeing on your agenda to make sure that we are addressing all these different points. I think we are, but we're currently working on that, and hopefully we'll have something by May, but I can't guarantee that, but just as an FYI, we are working on this to hopefully to be able to provide in the very near future. And of course, we'll probably have you all edit it for us as well, so to make sure that we are addressing all these things.
Miranda, is there anything that you want to bring up now? I mean, we'll have a meeting in June, and maybe that's the better time for us to discuss it more in depth, but as they're working on things between now and May, if there's anything you want to sort of flag for them.
Sure. Yeah, I'm trying to remember what I had brought up before and what I noted to bring up today, the difference between the two. Yeah, I'm glad to hear another TAC is bringing up issues. One of the things that's front to my mind right now is I was really excited to hear David's news recently. I guess maybe it was the last TAC, or maybe it was a KHBE meeting about connectors being able to input the information that they speak more than one language. But on the consumer end, like when I go to connect still, and I search for a connector, I can't put in a different language. I can't search for a connector who speaks a different language. And still, that's still not quite making the connection for it to be a reasonable, or not reasonable, useful information for the consumer.
Maybe like this iron weight.
Heard, Miranda. I'll look into it.
Thanks.
Understood.
All right, it sounded like you got cut off there, David. Were you gonna say
No,
something?
yeah, we'll look into it. Yes, ma'am. Sorry
Okay,
about that.
just making sure. Okay, and then let's see. I think we talked about these things that are on my list. We talked about a decision tree, okay. And clarifying to providers their responsibility to offer interpretive services. Yeah.
And it sounded to me, if I recall, either our last call or the call before that, we had talked about a decision tree, and it sounded to me like somebody at DMS was going to draft something for us to sort of, take a look at and then make some suggestions. Is that part of what Beth is working on, or Beth, is that part of what you're working on?
Sorry, I was having a really hard time unmuting myself. Yes, that is what we are working on. And we're very much in the information gathering phase now. Like Angie said, we do hope to have something to you guys by mid-May. And it may very much still be kind of a work in progress at that point. It's a lot of information once you get into it. It gets pretty complicated. And, we want to make sure that we're on the right track and that we're putting together something that's going to be useful for members. So definitely look forward to being able to share something with you and getting your feedback and working together to come up with a useful material.
Okay. Yeah, no, that sounds good. I'm glad you're working on it, and we'll keep this on the agenda for June so that we can review it then. If you're, as part of your information gathering, if you have questions about certain types of language access, whether it's interpreters or translations, and it would be helpful, for us to connect you with anyone we can. I mean, Miranda is a good resource, I think, herself, but then I'm thinking about interpreters that work at federally qualified health centers and others that I think could be really good resources.
Danita Coulter, who is our Equity and Determinants of Health branch manager, I believe she's on here. She's been working with Beth and others on getting this information, so I'm sure we can also reach out to Miranda as well.
Absolutely. Yeah, and I'd be really excited to hear if there are any updates to some of the items we have listed here, like CHFS recruitment or anything. Now we're in June.
That I don't know. I don't about the recruitment of bilingual staff, but and I'm pretty sure that's not part of what we're working on, but we'll see if we can find somebody who might know what that is about or what's being done or not.
Yeah, and perhaps that was more on the KHBE side. I recall that being part of the conversation.
Yeah, I agree. It was more related to KHB and connectors and call service workers. Yep.
Right. All right, so why don't we move on to new business, and the school Medicaid updates would be the first item. I know that there was a survey recently of schools, and was curious to know about, when that data would be released or in what, sort of what form we would be able to see what schools are saying in terms of whether they're participating, the services they're providing, that kind of thing. And then any information you can share about the pending grant proposal to CMS.
Hi, Emily. This is Erica. So the data that we collected from the schools, we are still compiling that, but I can give you a little bit of information on that. We had approximately 70 surveys that were completed start to finish. And the results indicated that the districts that have not implemented expanded access, it was due to them not having staff to administer the program or not being familiar with expanded access. So for that reason, we are putting together some more materials to make sure that all school districts are familiar with what is covered under expanded access. And also the materials that we already have available, reviewing those and making sure that if there is a lot of staff turnover, that training new staff isn't incredibly burdensome. So just making sure that all the materials that we do have as of now are easily digestible. Also included in that survey was a competency self-assessment, and that also indicated that district staff were not familiar with the covered services as well. Preparing training materials covering the expanded access is a top priority right now. Additionally, from the survey, we found that districts were using several different methods to deliver services to students. So some were hiring staff, so they were becoming school district staff to do the services. Others were contracting out, and the billing was different as well. And so we are wanting to make sure that we have materials out there for school districts so that they're able to know the different options that they have and determine which is best for their school district and meeting their students and budgets and resources needs. And let's see, and then the update on the grant proposal, we have submitted it. We haven't heard back, but we are optimistic that we will be funded. We will let you know as soon as we know, but the funds are to be released to states on July 1.
July 1, okay. And when do you know, when are awards announced?
It was like late June, I think. So it was going to be like almost
Okay.
simultaneous. So
So we
yeah.
have to wait a while.
Yes.
All right. It was a short turnaround for a CMS grant
It was less than 60 days. Mhm.
and in the middle of the legislative session. I didn't, yeah. But we really appreciate you all putting that together. And I think I shared this in a different meeting, Erica, but the Kentucky Health Center Network is also doing a survey. And I thought it would be something that you all might be interested in just getting their data and seeing how it might, sort of complement the data that you've collected, maybe add in some new information that you don't have. So I asked if they would be willing to share it, and they said yes.
That would be helpful because we do know that there were 3, maybe 4 surveys that all had a similar theme that were out around the same time. And so we thought perhaps that is why we didn't get the results that we anticipated was, if you see something, you're like, oh, I've already completed that one. So, I mean, that's a possibility, but if any others would share their data, that'd be great.
Yeah, okay. And I'm not sure when it'll be available, but I'll keep you posted. I don't have anything else there unless anyone else does. I guess Miranda, it's just the two of us now holding it down. The next item we'll continue to carry this forward until Arthur and whoever his guest is that he's going to have speak to this issue, the Michelle P. waiver, are available to speak to it. So we'll just bump that for June. And then the last item that we have is the alignment of quality initiatives, something that I think was brought up a couple of meetings ago when Veronica was with us. And I don't know if there's much more to share in terms of engaging stakeholders in this alignment initiative. Something more specific that I wanted to ask about was the social determinants of health screenings as well and the referrals.
What do you want to know?
Well, I guess the two parts.
Well, first part,
the engaging stakeholders in aligning, quality initiatives. That was one thing that I know is kind of like on the, sort of on the agenda for this year. At some point, it's a priority.
It's still on the agenda.
Do that work. Okay.
It's still on the agenda for this year.
Okay.
But I thought I had my video on. Sorry.
Right.
It's a work in progress. Let me put it that way. And also, regarding the SDOH screenings and referrals, we've working with our managed care organizations and getting them set up with Connect and those SDOH screenings that are available on Connect and driving members there and hope, and get data from that as well on those types of screenings and who are they filling this information out? Who are they being referred to, and trying to do a closed loop referral system through that. As leveraging Medicaid reimbursements for health related social needs through the 1115 waiver versus Lewis services. That's still being talked about and thought about, and figuring out which direction to go with that.
Okay. To go back to the screenings and referrals for social determinants of health, I know one organization that was interested, I think you already have a meeting scheduled with, which is Zero V, talking about, how their domestic violence shelters can participate in this process and what they need to know, and, what happens when there's a referral that can't be, that is either not something that they're able to take care of themselves, or, you know, they're just unable, they don't have the capacity for it, or maybe it's an inappropriate referral for them and they need to, you know, hand it off to someone else. I think those are some of the questions that we're getting, you know, as far as the screening is great when the referrals are made, you know, what does that network look like? And how do we ensure that people are getting the services that they need? Is there a responsibility on the part of the referring agency to make sure it's a closed referral, that they either respond to you or
No.
pass it on to someone else?
No, the short answer is no. You know, it could be, and yes, we do have a meeting tomorrow at 4, and I think she invited you, Emily, to that as well.
Yeah.
You know, that's why we need to talk about the unintended consequences to these things to make sure that people aren't put into a situation and such as that, and how to best address those when those referrals may come around. So it's something that we just need to talk through, and I think it'll be good to understand where Olivia and her group are coming from and how we can ensure those things are addressed.
Yeah. And I guess too, you know, if having the MCOs involved in this, I think it makes a lot of sense. I know hospitals are doing the screenings as well. And just, you know, who's responsible ultimately though, to make sure that the referral, you know, either gets done or gets closed, or, you know, whatever the case may be.
Well, I mean, ultimately, the responsibility is the person who needs the, you know, they're filling this out, they're getting this recommendation. All we can do, or the MCO or who the connector can do, is encourage and, you know, provide the information. Obviously, if the person's in case management via the MCO, they would have more contact with them. Or they may be through this referral system that they need to be in case management if they're not already. So there's opportunities there, just how to bring it all together. I understand the concern with that and making sure that people are getting the assistance that they need.
Well, it sounds like there's some learning as we go, which
Yes.
is always the case to some degree, but I'm also curious to know if there's any state that's doing this really well, and I haven't taken the time to look into it, but thank you for making time to talk with Zero B tomorrow.
We have talked to Iowa
Okay.
on SDOH screenings and developing a dashboard as well. So
Mhm.
we have done some preliminary review of this of other states. So it's work in progress. Much like a
and
lot of things that we're doing.
aside from, you know, helping the individuals and being able to be responsive to their needs, of course, we also want to know, just generally speaking, as we're collecting data, you know, from the screening and then from the referrals, what services are available out there and which services aren't available, so that there can be
Right.
more targeted sort of focus on building those up.
Absolutely. Know where the holes are.
Yeah. Miranda, do you have any questions related to this? Okay.
No, thank you.
Any other things that you want to discuss, issues? Questions, suggestions? Okay. Well, then I think we'll forego recommendations. We don't have a quorum. So we'll come back in June and hopefully have more members present with us so that we can take care of the minutes and also have some recommendations to put forward. But until then, I will be the person representing us at the next MAC meeting, which is going to be in May. I didn't put that on there, the date, but it'll be in May. And then our next consumer tech meeting is going to be at 1:30 on June 18th. And so we will continue to address some of these items, especially the ones that we didn't touch on too much today. And of course, I'll reach out for any other items beforehand. And one thing I wanted to ask Erin, as far as the structure of the agenda, I think we've been using this kind of structure for probably at least a year now. I find it, you know, we do a lot of jumping around between old and new business, and some of the similar topics kind of get split between those two items. I'm wondering if I can make the agenda more topical, like have everything about waivers in one section and just have old business and then new business and then everything about Medicaid renewals, old business, new business. Does that make sense? Could we do it that way?
It's your agenda. So if
Okay.
you would like to structure it that way, it's fine with me.
Okay, great. I
It
think
might actually
this was
help
a
me keep up
template
with where we're at.
this was a template that DMS had given us. And so I was trying to follow the template, but I felt like maybe I could just make a few adjustments to it. So I'll do that for the next meeting and we'll see if we like it better.
I think a template was started because there were some TACs that were asking for one, or they had new chairs and didn't have, you know, a copy of their previous one. So we put one together to try to give a little guidance. And but yeah, it's your agenda if you need to structure it, because not all TACs use it this way. So
Gotcha. Okay. All right. Well, I'll work on that then. But thank you. And thanks everybody for your time today. And I think we'll adjourn.
Thank
Have a
you.
good afternoon.
Have a good afternoon.
Yeah.